Hi, my name is Steve Bailey, and I'm a psychologist here at Psychology Houston. In my work as a psychologist over the years, I have worked with many people who were trying their best to find ways to live as well as possible to heal after the death of a loved one. So I'm going to do a series of videos discussing grief and loss and mourning, hopefully to provide information and ways of thinking about the tasks of grief and mourning so that you can heal as best as possible after someone you love has died. There will not be very many more difficult challenges in your life than to find ways to live as fully and healthily as possible after someone that you are very close to has died. Ultimately, we are built to heal, and I suspect we all want to heal, but we may not know how. There are many misconceptions and sort of ways of thinking about how we ought best respond after a loss. And so hopefully this information can help to give you maybe different expectations and a different guide, in a way, roughly speaking, to how you can heal. It is of course the case that grief is unique and that we're all going to experience our grief in different ways than others, and that's completely fine. So grief basically is how you respond to loss. Grief is going to affect you emotionally. You're going to feel certain feelings when you think about your loved one. Common ones would be sadness, despondency, hopelessness, anxiety, all kinds of feelings. Grief also affects how you think. When people are in the midst of dealing with a difficult loss, they oftentimes start to think in ways that perpetuate or make their grief worse. Grief is going to affect how your body feels, no question. Bereaved people report all sorts of changes in their body. We'll talk more about this in future discussions. Grief can affect you on a spiritual level. Grief will affect your relationships, your social networks, and your ways of interacting with others. And there are also many, many different factors that relate to the type of grief you will have, depending on the type of loss, how sudden it was, etc. Many, many things to think about. So for this, for the purpose of today, I would just like you to begin to think about grief as your overall set of responses to loss, and to begin to think on the idea that there are many things that we can do to help ourselves heal. We are built to heal. We're built to cope with all sorts of challenges in life, the death of a loved one being one of these. And in future talks, we'll go over all sorts of ways that we can help ourselves through our journeys with grief. Thank you very much. Look forward to talking with you again soon. Bye for now.